It's doing its thing. Okay, yes.
Hello, everybody. Welcome to this new event by me, you, and the Superbugs. It is using antibiotics correctly to protect your health. So today we are going to be learning about the safe use of antimicrobials and focusing on what antimicrobials, especially antibiotics, are and what antimicrobial resistance is and the measures to take to use medicine safely in for ourselves, our family, and the community. So at me, you, and the Superbugs, we are focused on antimicrobial resistance awareness. This is more than just event, it is a movement towards protecting your health and combating the growing problem of antimicrobial resistance. We focus on the responsible use of antimicrobials and we aim to educate and empower individuals like you to make informed decisions when it comes to their healthcare. Welcome again to this event. The event will be in two parts, the talks and the question and answer session. So feel free to ask questions that are relevant and also contribute your thoughts. Um, as the speakers are going to be speaking, feel free to type in your questions in the chat box, type in your appreciations or contributions, and they will all be acknowledged. Before we start, please, it is important to know that this information is provided for educational purposes only, and it should not substitute as professional medical advice. You must consult with a healthcare professional for personalized guidance and recommendations. While every effort has been made to ensure the accuracy and reliability of the information, the content may contain errors or inaccuracies, omissions, or ambiguities in the provided information. Welcome once again. Please mute your microphones and listen in. Our first speaker today is going to be Dr. Orede. Please, just a second. So, Dr. Orede, she is the founder of Me, You, and the Superbugs. It is the first event in Nigeria in 2018 following a grant from the Royal Society of Biology. She's a passionate advocate in the field of antimicrobial resistance work. Orede is actively engaged in research, science communication, and public awareness campaigns with a goal to ensure that everyone is equipped with the knowledge of how to use antimicrobials effectively. Her experience in academia and biotech industry has cut across the field of microbiology, drug discovery, and science communication over the past 12 years. Please, let's welcome Dr. Orede. We can use the reactions if we are able to. Thank you. Dr. Orede, over to you.
Okay, thank you, Miracle. Thank you, everyone, for popping in today. I am sure that you will have, we will have an interesting time. All right. So just give me a thumbs up if you can all see that, please. Can you see the slide? Can you see the slides? Okay, fantastic. All right, so let's start off with very quickly what's the who, the what, the why of MIU and the superbugs. All right, so why MIU and the superbugs in the first place? So this began in the year 2018, really focusing on, because there is resistance to specific antibiotics reported in several parts of the world. If you can find different sources and different articles that report this, especially with a lot of problem in sub-Saharan African countries, Western Africa as well. But the problem is everywhere. So there's widespread misuse and overuse of antimicrobials. For this particular talk, we're going to focus on antibiotics. So when we talk about things like your Flagyl, your Cipro, your amoxicillin, those are all antibiotics. And I'm sure if you live in different types of countries, not all countries, but even in our country, Nigeria, we know that it's readily available over the counter. People can get them quite easily. So what we do is provide, it's an educational intervention to increase knowledge and raise awareness of antimicrobial resistance. So that's what AMR stands for. And other related topics, so infection prevention and control. We really reach out to everyday users of antibiotics, such as myself, you as well, parents, caregivers, healthcare professionals, both clinical and non-clinical staff, equipping you with the knowledge of the science behind AMR, antimicrobial resistance, and how, if you're a healthcare professional or somebody who after this becomes quite enthusiastic about, championing this and raising awareness in your own communities. There's training on how to be able to communicate with your community. So it's mostly not just lecturing people, but placing the responsibility in their own hands so that they can impact their own environments as well. So that's just a snapshot of some of the things we've done so far. It began in 2018, several events in 2019 and then 2020 up until now. So let's start off quite quickly with the basics of antimicrobial resistance. So what is antimicrobial resistance? That's what we're going to be looking at now. All right. So I'll just give you a second to interact with me in the chat. How would you rate your knowledge about antimicrobials? If you're able to use the annotate pen on your screen, you can circle on the screen. So either one, your knowledge is excellent, you have no gaps in your knowledge, you want to learn more, or it's all new to you. So I'd like to know a bit more about people in the room so I know how to tailor the talk. All right, so if you could please type in the chat, or if you can use the annotate you draw on the screen, and let's see what people are saying. Okay, I'm going to pause and take a look in the chat and see what. So option 2, want to learn more. Anyone else? Very good knowledge. Okay. Others? Two, want to learn more. I'm just going to wait for like when I have 50%. Some people say it's all new to them. 2, want to learn more, and then 1. So we have a few 1s. So kind of balance with 2s and 3s. Okay, fantastic. That's great. All right. So I'm sure after this, your knowledge will be on another level. So let's think about this. What is AMR? So you often hear AMR, AMR. Just remember that when I say AMR, I mean antimicrobial resistance. So saying antimicrobial resistance is a mouthful. All right. So I will refer from now on as AMR. So anytime you hear AMR from now on, you know what it means. Okay. Sometimes you will hear antibiotic resistance. That refers mainly to antibiotics. All right. So let me start first of all, what is an antimicrobial? Because before you can talk about resistance, you have to clarify what is an antimicrobial. So these are usually generally substances they're designed to kill or inhibit. So not all antimicrobials will kill the microorganism. Some of them will inhibit the growth, like slow down the growth, and then you can't really, the pathogens cannot multiply in whatever maybe environment that they have infected. Okay, so we have microbes such as your bacteria, your fungi, your protozoa, your viruses, all right? We can't see them with our naked eyes, all right? So you need often the help of a microscope, isn't it? Depends, is it an electron microscope, scanning, we have different ones. I won't go into that because we have quite a range of people in the room. If you want to learn more, you can contact me later. So we then have antimicrobials, and it's just in the name if you break it down. Microbes, all right? So I don't want you leaving this room thinking, oh, all microbes are bad. No, and I'll get into that in a bit. So the antimicrobials, that are designed to kill or inhibit the growth, right? And that could be targeting bacteria, could be targeting viruses, fungus, protozoa, different types of microorganisms. So that's very important to note, because if you get that from today, it will really change the way you view the use of antibiotics. So some examples of antimicrobials, we have antibiotics, which are an example of an antimicrobial. So biotics, antibacterials, antivirals against viruses, and antifungals. But today, I'm going to focus heavily on bacteria, all right, on antibiotics. But I want you to at least be aware of what antimicrobials are in general. So just like you, if I were to put you in a very tough situation, you want to resist, you want to survive. So it's the same thing with any microbe, with any sort of living thing. They want to survive. Well, viruses are not living, kind of call them like particles, but they want to be able to reproduce, propagate, divide and conquer, wherever they are and make sure that the only ones there. That's what you should think about. So it's an evolution, what we call evolutionary thing. It's a normal occurrence, all right? However, so not even however, in saying that, you can then begin to think that bacteria, they will continually change. They want to be able to adapt to their living environment. You move to a new place, you want to be able to adapt, you want to be able to fit in, you find your own place, and that's what microbes actually do. It's part of evolution. However, when we put antibiotics, right? Well, antibiotics are great. Don't leave here thinking they're bad. They're fantastic. It's just the way we're using them that's causing a problem. So antibiotics, they can put pressure, what we call in evolution, selective pressure, to select for the ones that are the champions. They have muscles. They punch the antibiotic and fling it out of the cell. So those ones are able to, what we say, they are resistant. So when bacteria change in some way that causes that antibiotic to become ineffective, we call that antibiotic resistance. So you can change that definition to if a virus were to change in some way as well. So this sort of changed bacteria, this sort of changed microbes, you might hear them from today being referred to as super bugs, because bugs, germs, so they're super bugs. Okay, so let me give you a little hint into some things that happen in the lab. How do scientists know if a bacteria is resistant or sensitive to an antibiotic? We can use what we call susceptibility testing, all right? And there are different standardized protocols that are used in different regions of the world, all right? I'm just going to give you a simple introduction into this, okay? So let's imagine what we call it's called a disc diffusion susceptibility testing. So you have this, what we call an agar plate. So you're going to grow the bacteria, basically, okay? So you grow them, then you put these discs. So if you look at the screen where my pointer is facing, you have this, what we call these different discs, and they're all soaked. This disc is soaked in different types of antibiotics, okay? We place them on this plate that has a very sort of jelly-like form. Anyway, just think you grew the bacteria on a plate, okay? And then you put these discs on. Okay, so you can see the differences here around antibiotic A, antibiotic B, antibiotic C. So where you see the clearing is the area where the bacteria was not able to grow around that specific antibiotic. So we say that antibiotic is susceptible. So in the region of that antibiotic, it wasn't able to grow. However, look at A. Okay, after maybe growing that plate for 24 hours, you can see the bacteria is able to grow all around A. It's not influenced in any way by it. Okay, so that's what I've just said. You plate the bacteria, you incubate it for a time, the bacteria grow, you identify the zones of inhibition, the clear zones, and that's how you say this one is susceptible to this. So this antibiotic effectively works against this one. It prevents it from growing around it. All right, so imagine that someone at home or we buy antibiotic A and we keep using it, all right? You're only training those bacteria to be more and more resistant, okay? So that's what I want to, but B and C still work. Now that's the issue. When we take an antibiotic, one antibiotic doesn't work for all types of bacteria, all right? So it's important to be able to use the specific ones that work against a particular bacteria. Okay, so that's very, very important, because as you can see here, same bacteria growing there, but different antibiotics, and it's this one that is most effective. All right, so why susceptibility testing is performed in labs? It helps the clinician to be able to choose the correct antibiotic for you. Okay, they're used for therapeutic or prophylaxis, so it depends on what the situation is, so prevention or treatment. Sometimes we have broad spectrum that work against different types of bacteria. All right, for example, if they've already begun what we call broad spectrum, so maybe there's an emergency. So broad spectrum is usually given to, maybe in an emergency situation, it just covers quite a range of different bacteria. So, but they might still do susceptibility testing in order to be able to specifically target whatever bacteria is causing that particular infection. All right, so it can inform change in the therapy that you're being given, and it can also be used for surveillance purposes to know, what's in this region, which antibiotics work best for this particular bacteria. Okay, so if there's no test, there's no guidance, equals uncontrolled use. So you're just treating the person blindly, and that can put patients at risk, and it can lead to treatment failures. So why is AMR of significance? Why is antimicrobial resistance significant? There is resistance reported for all classes of antibiotics. And I'll give you an insight in a minute about the different classes of antibiotics, okay, and how they work. All right. So what we call multi-drug resistant infections, they are infections caused by, for example, I'm focusing on bacteria, by bacteria, and those particular infection is resistant to almost all the drugs we have to treat them. And one of the reasons this is happening is because of some of the things that we are doing. Okay, so these multi-drug resistant infections are caused by bacteria which are not susceptible to different classes of antibiotics. Okay, and they are new even for something like as dangerous as TB. We have multi-drug resistant tuberculosis, and see over 500,000 cases reported worldwide. That's almost 1 million people infected. And there's this big paper as of 2022. Research has shown that just under 5 million deaths are associated with bacterial antimicrobial resistance. So that tells us that there is work to be done. So let's look a bit more into how do antibiotics work. They work in several ways. So if you have a bacterial cell, it has different parts, the way you and I have different parts. So antibiotics are designed to target different aspects of the bacteria. Okay, why am I telling you all this? It's important I'm telling you all this so that you begin to understand that one antibiotic is not magic medicine. It's not African magic that will kill all the types of bacteria in your body. If you're using the wrong one, then it's just strengthening the resistant ones. So some of them target the cell wall of the bacteria, so that you can think of that like the outer covering. Some of them target the synthesis of specific proteins that the bacteria need to survive. Some of them target the nucleic acids like the DNA, so they cannot reproduce in any way. Some of them disrupt the inner cell membrane, so they make the bacteria to burst. So there are different ways that these antibiotics work. Now, let me talk about one in particular, flagyl. The sort of scientific name is metronidazole, and this is one of the antibiotics that is highly abused, right, in our country, Nigeria. So it's important. So this antibiotic is commonly prescribed for various infections. Okay, it has a unique way that it acts. So how antibiotics work, we call that mechanism of action. So when it enters the bacterial cell, it will go and target the DNA inside the bacteria, all right, and it will cause the DNA of the bacteria to break up. Okay, so it's effective for organisms that grow under very little or no oxygen at all. And we have some of those bacteria in our body. So we have good bacteria and we have bad bacteria. Bad bacteria can be a good one that is in the wrong place. And bacteria everywhere. You have bacteria in your gut, in your digestive system. Very important because they can help us in the production of several vitamins. All right. So if you're using antibiotics for a prolonged period of time, all right, and it is clearing out the good bacteria that you have, that can be a problem. Because if it's clearing out the good ones, then the bad ones have more energy. They will be able to multiply in different parts of the body and then cause other problems. And the benefits you have from the good ones are now destroyed. And that might be the case why some people are beginning to have some certain types of diseases. Okay, so then we have another one, ciprofloxacin, all right? That one too is also targets some parts of some particular proteins in the bacteria. Okay, so it's important that we are really careful how we are using these antibiotics. And we have some other types we have the cephalosporin, tetracycline. I'm sure some of you have heard of tetracycline that targets the proteins in the bacteria. You have the sulfonamide. So resistance to antibiotics, remember, occurs when bacteria, not you, bacteria, change in some way. They can change their genes in some way that enables them to survive exposure to antibiotics. The problem now is that as you expose yourself to more and more wrong antibiotics, the changes in the bacteria, those genetic changes can be passed on to other generations of bacteria. So you have them multiplying and spreading, thereby causing the development of antibiotic-resistant bacteria, all right? And the overuse and misuse of antibiotics contributes to the development of this antibiotic resistance. So I'm going to stop here now. What did I say that flagell targets in the bacteria? Can you put it in the chat? Who was listening? So flagell targets what in the bacteria? Anybody? Flagell antibiotics, metronidazole. How does it work? So people are clapping, but I asked the question. What does flagell, the antibiotic, how does it work? What does it target in the bacteria? Yes, the DNA. Thank you very much. So it's the DNA. Okay, so let me quickly round up. What happens when we misuse antibiotics? I'm going to touch on two things. Antibiotics help us to treat infections, right? By killing or inhibiting the growth of bad bacteria. But they can also disrupt the balance of the beneficial bacteria. That's what I said in our bodies. So when we expose ourselves to antibiotics, it can reduce what we call the diversity of these beneficial microorganisms in our guts, for example, in our digestive system. All right. That disruption is what we call dysbiosis. You don't need to remember that big name, but I know we have some medical students in the room. So that's called dysbiosis, when it disrupts that balance of beneficial to bad bacteria in our gut. All right. So when it disrupts that microorganism community, those good bacteria, it means that you can begin to have things like side effects, gastrointestinal issues, diarrhea. Some people, it's because they are misusing antibiotics, that's why they're having frequent diarrhea, bloating, inflammation of different parts of your colon. Another key thing that is coming out in the research is that some of these beneficial bacteria, they are important for the synthesis of vitamins, for producing certain vitamins like vitamin K, vitamin B12. Vitamin K is a very important one because it's involved in clotting our blood. So when you have a wound, the reason that heals properly is because your blood is able to clot and begin the wound healing process. So it's very important that we're not misusing bacteria, just self-prescribing by ourselves. So what can we do? Education. You're already starting off very nicely by coming here. Following prescriptions, so take antibiotics only as prescribed by a healthcare professional. You have to complete the full course of the medication because sometimes you begin to feel better and you just let it go. You don't follow through. Communicate effectively. Be open and honest about symptoms if you're a healthcare professional, and you as well. Be open and honest about the symptoms you are having. Any previous antibiotic use, it matters. If you've been using antibiotics, buying it by yourself and taking it because I feel cold, malaria, antibiotic. No, malaria is not caused by bacteria. It's actually caused by protozoa. So the antibiotic is not going to do anything. You're just taking it and sending it down to your gut, and it's wiping out all the beneficial bacteria in your gut. So that's why we say antimicrobial resistance is a silent killer. Because when you then, if you're not resistant to many antibiotics, when you then need it, maybe you now have a multi-drug resistant infection. There's nothing available to treat you, and that's a problem. Another key thing, I think, especially because the high cost of healthcare in Nigeria, is to be able to prevent infections and make sure that your vaccinations are up to date. As a healthcare professional, what can you do? Clear communication, educating your patients about appropriate antibiotic use, emphasizing the importance of adhering to that prescribed regimen, the dose, all right? Telling them, not to share antibiotics because Mama James gave it to James, and James is now strong. So you go and collect the one that remained from Mama James to give it to John Paul. Please, don't do that. You are just training all the bacteria in the children's gut to be champions. Antibiotic stewardship programs. Now, we'll be having one next year for healthcare professionals. It's very important. Steps that you can take to adopt and actively participate in antibiotic stewardship programs as a healthcare professional, to encourage the selection of the right antibiotic in the right dose, the right antibiotic in the right dose for the right duration. As a healthcare professional, collaborating, so interdisciplinary collaboration among healthcare teams. There should be that communication with different teams, the infection control specialists, the pharmacists, working together so that the use of antibiotics can be optimized. And lastly, one of the more important things is there's also antibiotic misuse in agriculture. So veterinary guidance, you have to seek guidance if you're involved in farming, rearing animals. Please don't just be giving chickies all the chicken antibiotics. They'll be looking fat and fresh. Just training all the bacteria in their body to be resistant, and is going into the environment. Record keeping, if you're in agriculture, is important. Maintain accurate records of the antibiotic usage in your production. Responsible use. Use antibiotics in animals very strictly as recommended by the vet. Ensure the correct dosage, the correct duration, correct adherence to withdrawal periods. And there are alternatives. Explore and invest in probiotics, prebiotics, and vaccines for your animals. So I'm just going to stop there. All right, this was just a final slide to show you what I was talking about. So you have one bacteria present, they rapidly multiply, that's normal. However, within every population, there will always be some resistant ones. But because these good ones are so many, these resistant ones cannot really take over. But when we now pressure continually that prolonged misuse of antibiotics, we're training these ones so it will wipe out these good ones, and all we have left are the resistant ones. So very good to be careful. All right, and I've talked about you, me, healthcare professionals, what we need to be doing to ensure that we maintain the antibiotics we currently have. We make them safe for future generations. So thank you very much. I'm going to stop there. All right, thanks a lot.
Thank you so much, Dr. Oride. I learned a lot. I don't know about you all. So before we go to the next session, I'm going to be pasting a link in the chat box. It is a feedback link, and I'll encourage each of us to leave in our feedback, what we learned, any suggestion maybe that you have. Let's repost it. Yes. So this link is going to be what we can use to get the certificate at the end. I really learned a lot from this talk. We learned that this antimicrobial resistance are the changes that take place in the microbes or the bacteria, as we talked about, and it makes them resistant to these antibiotics. The antibiotics become ineffective, and this poses a problem for so many reasons, like we learned. It wipes out the good bacteria that we need, and it can lead to a host of side effects. So thank you so much, Dr. Orede. We really appreciate you taking out your time to do this. The next speaker is going to be Pharmacist Timmy Lane. Sorry, just a moment. So, Pharmacist Timmy Ogumbe is a seasoned community pharmacist with over 20 years of experience and is on a mission to empower women in their health journey with a focus on maternal and child health care. She shares practical insights and strategies for vibrant well-being. Please let us put our hands together for Mrs. Ogumbe with our stickers and reactions.
Thank you very much for having me on. It's a pleasure to be here, especially with a topic that is close to my heart, probably because of what I've been seeing in the pharmacy over the 2 decades I've been practicing as a pharmacist. I just want to double check. Are we hearing? Can you hear me?
Yes.
We can.
Okay, so I want to be sure before I go on. So, as I said, I am really, really excited to be here because this is a topic that is so much on my mind. I see them every day, and it's a battle for us because here we get to get this prescription, we can get these antibiotics without a prescription. So that restriction is not there, and the only thing we are hoping is that some of these things, like what you are doing with me, you, and the superbugs, will make sense to people and they will avert from such. Medication safety in children is what I'm talking about today, and tips for parents and caregivers. As parents, especially mothers, we are at the forefront of care of our children. Next slide, please. What is medication safety? When you hear that word, medication safety, It just simply means we are ensuring that the medicines that we take are taken in the right way so that it helps us get better and does not cause any problem. So we are trying to get the best out of whatever medications we are taking. You see, medicines are like fire. I usually say they are like fire. They are good servants, but they are bad masters. When they are misused, we get to, our health gets worse. But when we use them well, oh, that's great, because we are going to be able to get our health better. So this is one thing that we need to know. Medicines, it can go either way depending on how we use them. So that's what medication safety is all about, and that's what we are going to be talking about in the next half an hour. Next slide. So why is it important that we talk about medication safety in children? It's so important in many ways that I have listed in my slide. Their system, whether the digestive system, their liver, all their organs are still under development. And if we don't use drugs appropriately, they will be worse off for it. For instance, paracetamol now, if it is misused, their developing tender liver can be affected, and you could expose children to the risk of getting a liver disease. So their organs are still so fragile, so tender, because they are still undergoing development. So medication safety is actually very, very important in these children. Also, it's important we really talk about um, medication safety in children, because they are not small adults, in the sense that when we are trying to talk about drugs, they are not small adults. Sometimes you hear parents say, okay, so tetracycline is not good for children, and maybe it is 500 milligram. I'll go open the capsule. I'm talking like this because I work in a rural setting, in a suburban part of Lagos. So we see so many crude things. They will tell you, okay, it's not good, maybe it's because of the dose. I will open the capsule and divide this into two, and you are like, this thing is affecting the bone health and the dental health of your children. It's not about the quantity you are giving. You don't treat them as small adults. There are certain medications that are just not appropriate for them. Or take, for instance, a drug like coamoxiclav. The popular brand we know is Augmentin. We see people buying the 375 milligram or even the 625, and then they will say, I will break it into two for a child. And we are telling them that it's not so, because the clavulanic acid is high in those drugs. Clavulanic acid, Augmentin is made up of two parts. We have the amoxicillin part and we have the clavulanic part. Now, in the adult preparation, the clavulanic is rather high, and children get irritated stomach. For me, they have a tendency to get upset stomach from clavulanic acid. So we cannot use the tablet and say we want to break it into two and give a child. So these are the unique things about medication safety in children. Their own formulations and the way we give them are very different from the way we give adults, and people have assumed in error that they could do what they do for an adult, maybe in a smaller way for a child. It's not so. Why is medication safety important in children? Number 3, essential in preventing allergic reactions to medications. So because there's a tendency for children to suffer allergies from taking medications, even not only children, even adults, it's very important that we ensure medication safety in this population. Also, preventing long-term consequences for a child's health. Imagine a child you gave paracetamol to at a high dose that can cause liver damage. Who knows whether the damage can be permanent? Or when you start introducing indiscriminate use of antibiotics, causing dysbiosis, like our earlier speaker, Dr. Rode, said about dysbiosis, something that have has caught my interest in the last 1 year, this dysbiosis. And I am seeing quite a number of children coming up with gut disorders, coming up with indigestion issues, several digestive issues, probably because by the time I investigate and ask a lot of questions, we find out that indiscriminate use of antibiotics might be the culprit. For instance, I had a case where the child had been having constant tummy ache, and the mother felt, oh, antibiotics will work. Oh, constant tummy ache, it could be typhoid. And they just kept using antibiotics empirically, to the extent we started seeing this child passing out the food she's eating exactly as she eats them, or throwing up the food particles that she's eating. So of course the signs of indigestion was there, until we started counseling and saying how we can improve digestion through the use of probiotics. Probiotics are the opposite of antibiotics. Probiotics are actually the friendly germs that Dr. Rode talked about. Until we started doing that and following up on this little one before things started getting better. So we could actually cause a permanent damage in these children's health. God forbid, though, but it is not only just God forbid. We need to be aware and take action. Okay, so the next slide. These are some other reasons. Limited ability to communicate. Children cannot tell you this is what is wrong with me, especially the toddlers. And this is the population I really work most with. They can't tell you this is wrong with them. So it's very, very important we pay close attention to the details about patient safety in this population. Of course, it also mitigates the risk of antibiotics if you are using drugs appropriately. Remember the definition of patient safety. If you are using drugs in the right way to get the best out of it, or ultimately, as has been explained in the earlier presentation, will help to reduce the risk of antimicrobial resistance, which is becoming a reality that is staring at us in the face. Just last week, I encountered another of those scary incidences. Okay, so this child has an ear infection, and from what I've come to understand, ear infections can be rather a tough one to tackle. And the child has been oozing clear fluid on and off, on and off. They said they've tried a lot of things, they've done this, they've done that. Okay, I just realized I could not just touch this thing until we investigate further. So I recommended an ear swab culture, and it came back all antibiotics except for one. And I was just looking at this chart. I just had to do. It is not something that I could even intervene, because it was now getting beyond what I could do. Every single antibiotic but one, even those very, very new generation antibiotics, third generation, whatever generation we call them, were already beginning to prove resistant. The bacteria was already beginning to be resistant to them. And you'll be like, if this kind of infection now goes to another person, only God knows what, these things multiply. It's really a scary thing when you consider the long-term effect of antimicrobial resistance. So that's just an example of a case where antibiotic resistance is staring us at the face, in the face. Then, of course, if we are doing our due diligence with patient medication safety, issues with effectiveness too is also tackled. Next slide. Now, let's look at common medication errors that are made by parents and caregivers. Specific examples now, so that we are aware. Because I believe if we are aware about something, now it helps us take necessary precautions concerning those things. So the first one is we are not using antibiotics completely. So when they are well, no more use of antibiotics. I don't better. There's no need, I'm fine. And I'm like, hey, you may be fine clinically, but it doesn't mean that the bacteria has completely cleared. And only what you have done is to make them stronger again. The next one is self-administration of leftover antibiotics. I see this one a lot. We have talked, but we will keep talking. We will not be tired. Okay, so somebody is sick, and there's this impression that antibiotics are the panacea for every illness in this world. So once somebody is sick, the next thing he wants to do is to take an antibiotic. And I see some people come tell me, I remember say antibiotics wey I use the last time, the antibiotics remain like 3, so I just started using it again. And the first question I gave, why didn't you finish it the first time? And what makes you think it is this antibiotic you need the second time? Next one is sharing antibiotics between siblings. There was a day a lady came to the pharmacy, and after investigation, said, okay, this is what we recommended an antibiotic. And right there in my front, as she was giving this child amoxicillin antibiotics to be one of the twins, they were twins, she just gave the second one, the second twin. And I'm like, why are you giving let me use the other word, Kehinde, you are giving Taiwo antibiotics, and Kehinde doesn't have problem. Why are you giving Kehinde? She said, as they be twins, we need to give them together because their sickness always they follow each other. So we see this often. These are specific things. If a child is sick and you are recommended, antibiotics have been recommended, please give that child and don't share. There is no need for that. These are the things that are causing antimicrobial resistance. We also have incidents of people, maybe they are not getting better. That one happens a lot when you are not getting better. They feel that this antibiotic is not strong in quotes, So they will come and say, I've been on this antibiotic. I don't think it's working. Not strong. Please, I need strong antibiotics. These are another example. Using antibiotics for viral infection. That's how we see cases of common cold or flu, which we know is viral, because they have those feelings that look feverish. That general malaise makes them think, oh, it's a bacterial infection I have. Antibiotics are supposed to work. And so we have to preach the gospel of antibiotics don't work for viral infection. Next slide, please. So these are instances I've come across several times in the pharmacies. Those instances I am giving you here, these are the common examples of medication errors that are done. Incorrect dosage measurements. It's also probably maybe the person feels it needs more, or oh, it is too strong, and then they reduce the dosage for the child. I've seen those kind of things before. Ignoring side effects. It's weird, but it's true. So there's this woman who was on Septrin for her child. She was giving Septrin, that's co-trimoxazole, Cotrim. She was giving it to her baby, and the baby was coming out with all these breakouts that looked like Stevenson Johnson's. And what I was hearing was, it is working. They push them out. So let me give the child more. He's pushing it out. That was alarming. The child was suffering from severe allergies, and you are saying it is working, it's bringing it out, so you continue to use it. This is an example of a medication error I've encountered in the pharmacy, and also over using broad spectrum antibiotics. I'm afraid this one is not just caregivers that do it. Even we healthcare providers, because we want the thing to work fast, sharp, we'll just go straight ahead to give the one that will cover a lot of bacteria, that is broad spectrum, that has a wide range of activity against whether gram positive or gram negative, or different types of bacteria. I want to cover because we are not doing tests. That is also an example of medication error. Next slide, please. Now, having known all this, what is the way forward? What is the way forward? Over to the next slide. It's important that we communicate with healthcare providers. Parents and caregivers need to be open and communicate issues with medicine use. Ask questions. Don't assume. I love it when I get feedback from parents, mothers who ask questions about the dosage, about how it's supposed to be used, when it's supposed to be used. These are things that you need, and you need to be clear about exactly how to get the best for whatever medicine you are using for your children. It's highly, highly important. These are some of the, this is one important tip for me, because if you know, it helps to avoid those medication errors. And of course, you are enhancing medication safety. Organization is key. I love it when you are able to document whatever medications is being used for the child. It makes life so easy. Those information can be very vital to the healthcare provider, knowing the kind of decision to make. So many times I ask a parent, okay, so this child has been having this thing for this long. What medications have you used? And they are blank. I believe organization, documentation of these things is important in helping to ensure that whatever medication is given subsequently is safe and you get the best out of it. Ask questions. Okay, it's part of communication with the healthcare provider. Educate yourself. Sometimes it also means that you should find out one or two things if you have not been told. If you there's no way you can get information about something, there's no harm in also taking out the patient leaflet inside these medications your children are using and read it. Why not? Sometimes we may not even know the child is allergic to some things. Maybe it was an oversight, but you could save the day by also going through the patient medication leaflet to get information that could help you get the best out of whatever medicine your child is taking. And also follow dosage instructions carefully. There are some drugs, for instance, an anti-malarial that is said, like what they call it, artemether-lumefantrine. The first and second dose is 8 hours apart. So most times we just hear morning and night, and there's a reason why you are told to take another dose, not 12 hours, but 8 hours after the first dose. So don't assume, oh, morning and night, okay, we can do twice a day, morning and night. No, you give the first one and then after 8 hours. There is a reason, because there's this particular way will help us maintain a good level of the anti-malarial at the initial stage. So everything has been well thought of. So if the manufacturer is telling you to use it first and second dose 8 hours, there is a reason. So we need to learn to follow these our medications that we are using carefully. It's just like saying Ampiclox is taking 4 in a day, 4 times a day, every 6 hours. It's supposed to be eating every 6 hours, not just 4 times a day. So you see some people say, okay, let me take 2 in the morning, 2 in the night. No, sustaining a level of antibiotics in the bloodstream is dependent, that we tackle the infection is dependent on how we are using it, the duration, the timing. So there's need to follow these instructions carefully to be able to get the best out of the medication. Next slide, please. And of course, monitor side effects. It is not compulsory that you must finish the drug. If there are side effects, you need to discontinue, because it could cause even more problem than what was originally there. So there was a time when I was in the university, I had a sore on my leg that was oozing clear fluid. I knew it was infected, so I went to our school clinic and they placed me on an antibiotic injection, protein penicillin, for some days. But I noticed that after like 3 days, I broke out with rash all over. So instead of me going straight to the injection room the third day. I just went straight to the doctor's office and said, see, I don't know what this is. Immediately, she discontinued that antibiotic I was on. So it's important, and of course, there's a reason. It's important that those side effects are monitored so that you don't get the worst out of the medicine, but the best out of the medicine. That's patient safety. Ensure full course completion. If there are no side effects, if there's no reason for you to discontinue, ensure full course completion. Don't say, I am feeling better, my son is no longer having temperature, I can stop, I can discontinue the medication. And also store these products in safe places. Some degenerate with time, with temperature. The temperature should be at a good temperature. Sometimes if it is too hot, like in the climate here, it's really, really hot sometimes, and it can affect how the medicine the presentation of the medicine, and of course it will affect the quality and how it eventually works. So ensure these medicines are stored. They usually write how it's supposed to be stored. Store in a cool, dry place. Store below 25 degrees centigrade and all that. We should ensure that these things are stored properly. Now, promote hygiene. Of course, this is one of the things that will help us to get the best out of our medicine. If we promote hygiene, there's no need to be taking antibiotics every now and then, exposing us to the risk of antimicrobial resistance. So promote hygiene. The first one is hand washing. There are so many hygiene practices. These are things I teach mothers about: hand hygiene, respiratory hygiene, and all that, just to make sure that we don't expose ourselves to getting frequent, or our children to getting frequent infections, which will now elicit the need for them to take an antibiotic. And then lastly, regular follow-ups. It might be necessary to check in with your healthcare provider on what medications you are on and progress and the way forward. Next slide, please. So I've come to the end. So in conclusion, ensuring kids tackle their medicine, making sure kids take their medicine right is super, super, super important. We cannot overemphasize that fact. And it helps them stay healthy and strong. And I'm sure one that really wants to stay healthy and strong, especially when dealing with superbugs that have become invincible. Many of them have become invincible to antibiotics. I remain anti-pharmacist. I hope this has helped you one way or the other. Thank you for having me. Thank you for listening.
Thank you so much, Ma. We really appreciate you taking out your time to speak to us on this very important topic for the care of our children. And it's something that a lot of time when I was growing up, we just pop a pill when anything goes wrong, and then we'll be fine, and then that's just the end of it. And it's something that we really need to talk about. We need to spread the word. Thank you, thank you, thank you. Some of the things that You're welcome. Some of the things that she talked about that I got from that session was prevention is very important. When you prevent something, it is much better than when you have to treat something. And one of the ways we talked about is maintaining proper hygiene. It's so important. Washing hands. Children are able to, they pick up anything and the first thing it goes into their mouth. So we need to watch out for all of these things. We should not ignore the side effects of the medications. When you want to see that something is happening to you after you started taking a medication, go back to your healthcare provider. Tell them, oh, this one went wrong and that one went wrong, and ensure full course of medication. Ensure that you see the medications to the end. That way you will not have something left over to use another time and abuse it. So thank you so much. So we're going to be going into the Q&A session. Though I haven't seen any questions in the chat, but I'm guessing some of us may want to say our questions to each of the speakers, either Dr. Oride or pharmacist Ogumbe. Please, if you have a question, feel free to turn on your microphone and speak. Anybody? Okay.
And pharmacists, please, when people notice side effects, please, can you go over what it is that they should do?
Communication with the healthcare provider is super key, so that they are in the best position to be able to make a decision on what next to do. So once you see a side effect, don't keep it to yourself. Please go and check in with your healthcare provider.
Thank you.
Can I say something there too?
Yes, please, pharmacist. Go ahead,
That
please.
was excellent, Simei.
Thank you, ma.
Yeah, because you did touch on a lot of issues there, and I just wished many mothers had joined this. I don't know what we'll do because mothers are very critical in these things that we are talking about, having seen so many things that they do with these drugs. So, and we know what antibiotics is doing in the space of resistance. So when you notice side effects, yeah, it's good to run to your healthcare professional, especially the person who prescribed it. Or you may also take advantage of your pharmacist if you have access to the pharmacist. The reason is that we are trained to manage such situations. So it's good to talk with one. And sometimes even what is called side effect may not be a side effect. I've seen many cases that they will say it's side effect, but by the time you evaluate the situation, it's not side effect. And when it's not a side effect, then the best thing is let's continue the therapy. With encouragement, the patient is able to take everything in. Now, I just want to lend my voice to the magnitude of antimicrobial resistance. I've seen quite a number of cases where people needed surgery and they could not be operated on because they isolated resistance strains. Imagine somebody traveling out of the country to undergo a process and they could not carry out that procedure because they found superbugs. So it's very alarming because a number of times it's not now the problem that kills is the superbug and we end up killing the patient. And then imagine that patient having to come back home because they could not carry out the procedure. And then they're now managing the superbugs until they get rid of the superbug before the procedure can be done. So please, let's all hold this very, it's so important. I'm meant to be in another program, but because this is so critical, that's why I'm sharing myself between the two, because we just must be antibiotic guardians wherever we find ourselves. Let us start shouting it. Let's scream it to the world because this may be the next pandemic. Dr. Rode, you are doing a great job because we just need to hear this. Everybody needs to hear it. This is not multivitamin for crying out loud. Even multivitamin has doses and they must not be misused. How much more these drugs, the way they are used, we are in trouble very shortly. It may be the next pandemic. So please, if you are here and you have been part of this program, go out there and preach this gospel. Don't use antibiotics or anti-infective except it is justified. And how do you know it is justified? See a trusted, the right qualified healthcare professional. Let there be a diagnosis and then treatment follows based on the diagnosis. Thank you.
Thank you so much, ma'am, for that wonderful contribution. Does anybody have any more questions or contributions? Okay. I'm going to be pasting the feedback link once again in the chat box, and I encourage us to go ahead and fill in that form. It will enable you to get the certificate at the end of the event. In the absence of any other questions, please, I'll hand over to you, Dr. Reddy.
All right, thank you so much. And thank you everyone for your patience. It's amazing to have the turnout today. I hope you can all hear me clearly. So thank you so much, Pharmacist Lawal, Mrs. Lawal. It's been a champion from the very early days. This glass is reflecting. Okay, let me take it off. From the very early days. So I'm very, very grateful for that. I would like to encourage everyone. So one of the first things I said about me, you and the Superbugs, it's not just for you to come in, hear this lovely message, and then just keep it in your family. No, I believe that as Pharmacist May said, you have to share the good news that you have heard. So one of the things we encourage people to do is to sign up as antibiotic guardians. So thank you so much, Ms. Lawa, for reminding me about that, because we always do it at the end of every Superbugs meeting. I have put the link in the chat. All right. So I remember in 2019, they opened a page for the African sector. And Emilio and Superbugs were one of the first people to populate that environment. So I've put the link in the chat. If you just scroll up to sign up as an antibiotic guardian, and I'm going to go through right now in 5 minutes what it is about. So it's basically you making a commitment to say, this is what I am going to do. All right. Sorry, since it's not face-to-face, I don't have the antibiotic guardian badges. I usually give it to people. So it's usually sponsored by they're no longer called public. I think they are now called Health Protection Unit. I'll find out. Public Health England. And we used to have the badges and we'll be able to give it to you. But no problem, you get a certificate to show that you're an antibiotic guardian. And you can share it on LinkedIn if you have a LinkedIn profile, Twitter, start to share this message because you realize that it's because people don't know. That's why they're putting themselves in danger. So when you come to the Antibiotic Guardian page, I've put the link in the chat. Become an antibiotic guardian, you choose a pledge. So maybe over the next 12 months, what is it you're going to do? And this is a pledge to yourself. What are you going to do in your community? So you select from the list, human health, animal, which kind of professional are you? You can select any of those. So you can do it with me right now. If you open the link on your phone, if you're a citizen or farmer, student or educator, you can select one. So let me just say, maybe I'm a healthcare educator now. And then you see there are different pledges. So depending on what you choose here, there's a pledge for you. Okay. So for example, if I'm prescribed antibiotics, I would take them exactly as prescribed and never share them with others. All right. So those are different commitments that you are making to yourself or for other people. If you're a healthcare professional or educator, you pledge to develop awareness and understanding in your students of the challenges of AMR. So when I teach, I always try to, well, I think all my students know me. Even in my family, they call me Dr. Superbugs. So I really encourage you. And then you fill out your information here. What you need to do if you're doing this maybe on your phone, be careful because once you submit, the certificate comes up and you might just miss it. So just take your time to do it. Don't rush through it. And then you get your certificate. You can take a screenshot. Please feel free to hashtag me, you Superbugs, or send me a message. I'll put the details in the chat in a moment, just to let me know you signed up so we know how many people have signed up following on from this. So I really encourage you, sign up as an antibiotic guardian, keep following up our messages. If you want to volunteer, be involved in this movement, this campaign, do also feel free to send me a message. We're always open to volunteers. If you want to learn something new, that would be great. So I just really want to say thank you to the speakers and thank you to everyone who has made it today. If you've stayed till the end, it's important that you tell us how we did, what did you like, what any suggestions that you might have for improvement. All right. Complete the feedback form. So Miss John has filled that in, Miracle has filled that in the chat. So please click on the link and just give a thumbs up. If you already filled the feedback form, please give a thumbs up. That would be amazing. Okay, so today, I encourage any healthcare professionals in the team or future healthcare professionals really adopt and promote antibiotic prescribing guidelines based on your own local antibiotic resistance patterns. Ensure that as a professional, you understand the risk of antibiotics and their role in the rise of antimicrobial resistance. Provide training and education programs. If you're seeking education programs and you want to contact me, we can deliver this tailored to healthcare professionals and go into a lot more detail. All right. And then really begin to work towards implementing measures in your own, maybe in your own sphere of influence to monitor and control the distribution and use of antibiotics. I know pharmacist Lawal, she's the superintendent of Victory Drugs in Nigeria, and they're very, very keen about this. So in conclusion, addressing the problem of antibiotic resistance in Nigeria requires a concerted effort, all of us working together. That's why it's called me, you, and the superbugs. It's all of us that have to work together. So we have to work together, healthcare professionals, the everyday person, the market woman on the streets. I really love the stories that pharmacist Timei was sharing with us. So you can see the real life situations. Policymakers, let's encourage good antimicrobial stewardship, management, good practices. And I think in a country like ours where, there are issues with high cost of medical care, it's important that we also continue to promote vaccination and good infection prevention and control practices so that we are healthy in the first place and we don't need these antibiotics. So thank you very much for coming. Please fill in the feedback form. And once you fill it, there's a place for you to leave your email so that you can receive your certificate of attendance and so that we can also update you on future meetings. So that's it for tonight. Thanks a lot. It's been amazing to connect with all of you. Thank you, Wina, for coming. Have a blessed evening, and we'll see you in January. They have a special training program for healthcare professionals, so make sure you leave your email in the feedback form, and we'll be in touch. Okay, and please share the YouTube link with others. I'll put it in the chat now so that they can watch it back, or if you want to remind yourself, you can watch it again and again and again. So 1 second while I just put the YouTube link there. Okay, feel free to unmute and tell me bye.